The respiratory virus season has been no joke this year, and one local doctor says a small number of patients who've been hospitalized for COVID, the flu, or RSV are testing positive for several viruses at the same time. Your reporter Ashley Portillo is live from UC Health this morning. And Ashley, the doctor told you, although this isn't common, it does happen.
Yeah, Brian, good morning. Now, that doctor did mention it is a small number of people. Actually, about 5% of people who are being hospitalized are testing positive for two viruses at the very same time. Meanwhile, other patients are testing positive for one virus one day, and then maybe even a few days later or a few weeks later, that's when they're testing positive again for a different virus. Now, she also said, just like during peak COVID, the older you are, the higher risk you have of becoming hospitalized with what's called a co-infection, or if you have asthma or other breathing problems, that's when it can become pretty serious. Now, because the symptoms for these respiratory viruses are so similar in nature with a few slight differences, the doctor said it's hard to know what you have without being tested, but she did say people who do have two viruses at the same time will probably feel pretty sick overall.
Sore throat can be a component of any of these as well. Headache, body aches, fever, and certainly if you have both of them, it tends to be a little bit more severe, where if you feel like really wiped out, it could be more than one, could be just one alone.
And as for the flu season, that doctor also mentioned that we are seeing trends pretty normal this year. That does include a jump in cases back during the holidays, as well as a rise in cases throughout a spring break. That doctor also mentioned that COVID is behaving a lot more like the flu nowadays, especially this season. For now, reporting live in Aurora, I'm Ashley Portillo, covering Colorado First.
All right, Ashley, thank you.